Hey guys, today I'm going to go over how to properly use our PPE or personal protective equipment proficiently. So we're going to go over how to put on our gloves, how to properly sanitize our hands and wash our hands, how to put on different types of masks so that we don't cross-contaminate, okay? Okay, so first thing we're going to do is practice putting on and taking off our gloves. So this is important so that we don't cross-contaminate. So that means you don't touch something that has or could possibly have any kind of germs on it, and then you accidentally touch it again to your face or to your any part of your body, and then now you're potentially exposed. So you're going to try to slip your gloves on without touching the outside of the glove. Slide your fingers in. Now see how I have my finger holding the inside and not the outside? You want to try to adjust your gloves without touching the outside, okay? So with your gloved hand, you're going to grab your other glove, put your hand inside that opposite glove, put your fingers in, pull it up tight. All right, notice how I did not touch the outside of the glove. Now, after you've worn these gloves to do whatever it is that you need to do, go outside, make your shopping, or do whatever it is that you need to do, when you remove the gloves, you're going to use one hand to pinch the outside of the glove and pull it out. Now notice how I'm not touching anything else. My hand is slipping out, still holding on to the glove. Now with this hand, I'm going to ball it in a ball, put my finger on the inside of the glove, flip it inside out. Notice how I did not touch the outside, and there you go. This is going to go in the trash, okay? You don't want to reuse the gloves. Now I have 3 different kinds of hand sanitizer here. Now you want to make sure that the hand sanitizer that you're using has high levels of alcohol or ethanol in the back. You can see it'll say like a percentage. So like this one, for example, has 68% alcohol. This one has 62%. So you want to make sure that you have a high number in there, so that way whenever you're using it on the go, it'll get all the bacteria off your hand for that instant, but it's not going to protect you from getting more germs and stuff on your hand if you start touching other things, okay? And it's always a good practice to just wash your hands when you come back from the outside. Make sure that you're washing your hands with soap and water, and like a lot of the soap bottles say with their instructions, to clean hands and wash away germs, wet hands, apply soap, work into a rich lather for at least 20 seconds and rinse well. So I'm going to demonstrate how to put on the mask. So if you have your cloth mask, you're going to grab the ends and you're going to place it over your nose and your mouth, and you're going to put it behind your ears, and you're going to pull down at the bottom and at the top so that it covers both areas. You want to try to get a good type of seal. I know it's not easy with the cloth because it's loose, but you want to try to make sure that it's going at least across the bridge of your nose and about the bottom around your chin. Okay? Now I have 2 types of respirator masks. The first one I'm going to be going over is a K95 mask, not the N95, but a cheaper version, but it still gets the job done. So you're going to place it over your face, around the loops around your ears, and you're going to see the little respirator piece right here at the bottom. That's supposed to make it easier for you to breathe and expel carbon dioxide. Now the last one I have is the N95 mask, which looks like that. And this one has the loops, but they go over your head and behind your neck. So in order to put that one on, we're going to pull on the bottom strap right here. See the nose piece is at the top, the hook, there's a loop at the bottom and at the top, so you're going to have to face it away from you. Pull the bottom piece from the bottom of your chin, pull the rubber band all the way around to the back of your neck. Now it's going to kind of look funny because it's going to be loose, but you can see the metal part is where your nose goes. So you're going to flip it up, hold on to the rubber band, and then pull it across the back of your head. So you should have one strap on the bottom, one strap across over your ear to the back of your head. You can always adjust this portion here so that it creates a really nice and tight seal over the bridge of your nose. Your cheeks, you can see how much pressure I use because now my cheeks have gotten puffy, but you notice that it's a really tight feel and across the face. So you can see that. Alright, now to take it off, you're going to grab the rubber band from the top, pull it over, pull it down, hold on to the rubber band, grab the back of the rubber band, pull it over, and now it's off. Now the reason you want to do it like that is so that you're not touching the actual mask, because think of all the stuff that's touching your face, or that would have been touching your face if that mask wasn't there. So after you take off your mask, you're going to want to immediately wash your hands, okay? Alright guys, so we talked about PPE, personal protective equipment. So we talked about washing your hands for 20 seconds, using hand sanitizer when you're going out and before you get back into your house. Also, we talked about how to put on gloves and how to put on different types of masks. So make sure you're following all these steps in order to be safe out there. Okay, talk to you later. Now, I have a couple of different kinds of masks that we're going to go over. The first ones are going to be the cloth masks. Now, these are the kinds of masks that you can make at home, or if you know someone who is selling them, maybe you can purchase them, with your parents' permission. But these are just face coverings to protect you from spreading any germs